I prioritize the most important steps that a person can take to improve their health. Because I think a lot of people get mixed up, right? They think they get suckered into like a supplement, right? Or some gimmick or some fad, and they think, "Oh, I'm just going to take this supplement, and that'll make me healthier." But supplements, as you know, are low on the priority list. They're helpful, but if you don't make those big changes, the supplements don't do much for you, right?
Yeah, of course. You know, obviously, if you have to change, you have to make radical change. And and my life is, my experience has been that people making baby steps towards better health. They make an effort, but they don't see the results because they don't lose weight, they don't get well. And my frustration and my motivation over the last few decades was to have everyone with a chronic disease know that they could reverse it naturally and don't have to be on chemotherapeutic agents that cause cancer the rest of their life. And we're talking here about psoriasis, multiple sclerosis, lupus, rheumatoid arthritis, psoriatic arthritis, Sjogren's syndrome, ulcerative colitis. We're talking about, and people, I had, for example, patients been on the national renal, a girl on the national renal transplant list waiting for a new kidney who made a full recovery from lupus, and people in bed with psoriatic arthritis for decades making complete recoveries, and people having, 15 bloody bowel movements a day, ready to have the colon removed, who made make a complete recovery from ulcerative colitis, and people with, we're talking about so many people with multiple sclerosis, and that's what I wanted to even get out there in my latest book, Eat for Life, is not just the science behind it, but all these individuals that have made these dramatic recoveries. Because my biggest, message is to give people hope and tell them that medical care is a failure and doesn't work very well. You're going to be because people keep doing the same thing that's going to cause the disease, and then they take drugs, which were the first thing we learn in medical school, is drugs are toxic. They're poisons. So they put poisons on top of cancer-causing poisons, which are drugs, on top of a cancer-causing dangerous diet, expecting to get well. And all it does is make you feel a little better temporarily, but makes you sicker down the road. So that's the frustration. I don't care if people choose not to eat healthfully or choose to be sick or take drugs, but they have to at least know they had this option, that they didn't have to have their kidney transplant for lupus. They could have gotten well from it. They didn't have to take drugs that cause cancer for psoriatic arthritis the rest of their life. So we have to let people know they have an option, and they don't have to have heart attacks, strokes, dementias, and more than 90% of cancers are definitely preventable, and early stage cancers, or a lot of them, are reversible. Nevertheless, that's been my fighting message over the last few decades, and now with COVID thrust into the equation right now, people are thrust with danger immediately in their face. And now what the change they have to make are the same changes that they should have been making all along. The changes, and let's talk about them in the order, the priority. You're asking the priority of these changes. Well, lunch is the most important meal of the day because we get so much of those beneficial foods in during lunch. And I want people to structure their diet so they keep it relatively similar from day to day. And one of my mantras is, have a salad every day. The mantra is, make the salad the main dish. And so the point is, have a big salad of raw vegetables at least once a day. So the lunch is a big salad that includes not just lettuces, but also some raw cruciferous like baby bok choy or arugula or kale or something, and raw onion or scallion in there. And then we make a dressing that has some nut or seed in it, not oil, but some nut or seed in a healthy dressing, which facilitates maximize the absorption of these phytochemicals from the raw vegetables. And then you have to pay attention, like we make a delicious tomato sauce with sun-dried tomatoes, with almonds and walnuts and a little bit of black fig vinegar and some roasted garlic might be a dressing, or a dressing might be a fruit one like mango or orange with some sesame seeds and cashews and blood orange vinegar or apple cider vinegar or something. So you make delicious dressings, but the point I'm making is that the dressings are healthy. They're not full of salt and oil, and a little bit of fat in those dressings facilitates the absorption of the fat-soluble phytochemicals and antioxidants, which you maximize the beneficial effects of those raw vegetables. And then people eat a salad, they don't chew it very well. They swallow it mostly whole. And it's how well you chew those vegetables determine the formation of the anti-cancer immune supporting nutrients in the mouth as you're chewing. They're not just taking it out of the vegetables, you're actually causing a chemical reaction to occur in your mouth and activated also bad bacteria in the teeth and the gums that also improve the chemical reaction. And the better you chew, the more you have a benefit from it. And then maybe a bowl of vegetable bean soup or a chili or something with cooked mushrooms and onions and greens and beans in there, and maybe some fruit, fresh fruit or frozen fruit for dessert. So I want people to have this regiment where they have a big salad, vegetable bean soup or stew, piece of fruit for dessert, and make that a large meal of the day where they have a hefty salad and a bowl of soup, and that's their main meal. They can eat a lighter breakfast or a lighter dinner, and then breakfast is not that complicated. I mean, I don't see why the world can't at least change their breakfast and lunch right away like that and simplify it. Breakfast might be, for me, a cup of wild or black or dark berries or some kind of, with maybe a couple of tablespoons of grain in there, like quinoa or steel cut oats, and maybe a tablespoon of flaxseed, of chia seed, of hemp seed or something, with some, homemade almond hemp milk or something, or a plant milk on top, so it's mostly I'm eating berries, a little bit of grain and a little bit of seeds, but mostly I'm eating berries and fruit with a little bit of plant milk in there. So the breakfast is kind of simple, or it could be a piece of fruit or a glass of juice or a green smoothie, but so it doesn't have to be that complicated. And then for dinner, we have fun making exotic and incredible, delicious gourmet vegetable dishes. Thai and Asian and all kinds of flavors with lemongrass but we don't want to get up from dinner. We want to keep it an early dinner, a relatively light dinner, and not get up from the table stuffed, stretched out stomach, and having digesting food the whole night. You want to eat something relatively light because you want to go to bed on an empty stomach. You want to go to bed to get a full rest and not be digesting food half the night. And so I don't think this idea of nutritional excellence is so difficult to grasp or to do. And especially when we can show them ways to make it taste great. I think if people gave it a try and did it long enough, like most people that I've worked with, feel that they enjoy this way of eating, they get proud of themselves for doing it, they see miraculous transformations occur in their body, and they start to feel grateful for the wonder of natural foods, of what they contain, and the healing powers they impart on the human body, and they start to feel more grateful and have a better relationship with the world around them, and start to think more clearly and make better choices.